Hi, I'm Dr. Lisa Beecham. I'm excited to be talking to you today about immunisation for influenza and primary sense as a tool to help you in your general practice. I'm a grassroots GP of 25 years duration, and I'm also on the RACGP Queensland Immunisation and Partnership Group. I'm the chair of the Clinical Advisory Committee for Primary Sense and have a lot of input into helping to make sure it's evidence-based. So why do we want to change? A significant number of our patients are falling through the gaps. Sometimes they're not presenting and asking for influenza immunisations. Sometimes they're not aware about influenza immunisations. And sometimes they just might have other issues that are holding them back from being vaccinated. We know that annual vaccination is the most important measure to prevent influenza and its complications. It's important to remember to do this for anyone over the age of 6 months who wishes to protect themselves from influenza, but especially for our at-risk medically vulnerable groups, such as people with CKD, heart disease, lung disease, immunocompromise, pregnant patients, and our Indigenous population. We know the evidence suggests that vaccines are safe and effective and a perfect way to protect us from serious disease caused by influenza. Influenza immunisation across our communities also protects other people, especially people who are ineligible for the vaccination under the NIP program. We know the more people vaccinated in communities, the less likely the disease is likely to spread. And the most important thing is the consistent recommendation from the healthcare provider team in general practice has shown to increase the uptake of influenza vaccinations. GPs get a prompt to vaccinate at the point of care for high complexity or pregnant patients. Also, reports to find patients are available to find those that are booked in with a vaccination, without a vaccination booked at the same time, and those that are not booked in at all and haven't booked for a vaccination, and those that haven't visited for a long time, and to decide whether to inactivate those patients. Prompts occur, such as the screen on the right. So you can see that you might be going about your day-to-day general practice activities, and a prompt like this will pop up as you go to open the file. So that's a really good way of checking to make sure that you do deliver that vaccination key message to your patient sitting in front of you. So you have options of being able to go agree action, agree override, do it next time, it's wrong or missing information. And so with this, you can click on the air button just to double check that your patient hasn't had their influenza vaccination done at another place. If they haven't, it's a really good idea to try and do it at the time when they're sitting in front of you. But if that's not practical, I always click next time. That way I'll get the prompt again next time. If you click agree and action, the prompt will disappear for a couple of months. Another way of accessing our patients and being able to determine who does need the vaccinations is through the Winter Wellness Report. This is a report that can be downloaded where the primary sense reports are available on the toolbar. And it's really simple. It's a click of a button. It downloads within a minute, and you can use this to find patients that are coming in the next few weeks that don't already have a vaccination booked, or those that are not coming in the next 2 weeks but need a vaccination. This is an example of the Winter Wellness Report. You can see by this, you can see when the last vaccination was recorded. You can sort by individual doctor's name just by clicking on the GP name. You can sort by the last visit, so you can try and find those that are still active patients. And you can sort when the existing appointments are available. So you can be able to tell who's coming in the next few weeks that doesn't already have a nurse appointment for influenza vaccination.